hands up if you can hear me. Like, raise your hand. Okay, perfect. I'm not sure why you can't see me today. I have my video on. Oh, there I am. All right, wonderful. And I think my host is going to let me share my screen right now. So now you don't have to see me anymore. Okay, let me know if you're able to see my screen. Raise your hands for that. All right, thank you. Looks like we are off to the races. Hi, guys. Um, Welcome. This is the Practice in Pregnancy Orientation. I'm your host, Dr. Adams, and this is a little something that I do twice a month to welcome everyone to the practice, answer some first-time mom questions, some veteran mom questions. Those of you who are new to Full Circle, congratulations on your pregnancy. We have a couple housekeeping things first. This is confidential, so if you have questions, feel free to put them in the chat. I will answer them. If I think it is too personal, like it may reveal who you are, then I'll say, let's hold this until your visit. So please participate. I have lots of polls hidden throughout here to make sure that you are paying attention. And if you have to hop off at any point, I know we might run into dinner time. Just know that this presentation will be available for the duration of your pregnancy on our YouTube channel. So I'm going to give you an example of what the poll questions look like. So let's start with who's on the call. So you'll see me launch a question, it'll pop up and you'll answer whether you're a first-time mom or are you a veteran mom, and then I will give you couple minutes to answer, or a couple of seconds really, to answer the question. I'll say the polls are closing, and then I'll hit the end poll and I will share the results. And today, the first time moms far outweigh the veteran moms. The crowd is a little light today. I think people forgot about this call today, so I'm gonna have a lot of people asking me these questions throughout their pregnancy, but you all will be the rock stars who know all of these answers. So we're gonna go over the full circle experience, which includes where we deliver. We'll go through some office protocols. We'll talk about what to expect at your pregnancy visits, go through a ton of prenatal resources. So again, remember, all these things will be available on YouTube. We're going to go through exercise and nutrition in pregnancy in some detail, and then end with an update about upper respiratory infections. So let's start with how Full Circle is structured. We are a collaborative midwifery model practice, meaning that our practice is based on the baseline that pregnancy and birth are normal life processes. It's not a disease that you contracted that we have to cure you of. This is physiologic. This is normal. In the traditional midwifery model, we care for normal, low-risk women, but then if you develop any issues with your pregnancy, you have to transfer out in order to be able to access physician care. In the collaborative model, you stay in the care of midwives and physicians for direction. You may have a collaboration of women's health nurse practitioners, physician assistants, but basically, if you get to the physiologic part of it, which is the labor, contractions and baby coming out, that's physiologic. That's the same all across the board. Most of those are attended by our certified nurse midwives. So we share call. We don't know who's going to be on call when your baby decides it's my birthday. So we invite you to meet as many of our providers as possible here in the office. If during your labor there's something that occurs that's outside of the scope of midwifery care, they know how to get in contact with us. So if it's something urgent, like can't wait till morning, can't be scheduled, they will call one of the physicians here at Full Circle, myself, Dr. Merrow, Dr. Mooney. We're always on call backing up our midwives. If it is an emergency, like they can't wait the 15 minutes it takes for one of us to get in from home, there are OB hospitalists, board certified OBGYNs who are in-house 24 hours a day for true emergencies. And to put it in perspective, in 2024, we did about 600 deliveries. We used the hospitalist 4 times. Those 4 times, at least 3 of them were just babies who were just coming out. Like it wasn't even an emergency, like the midwife couldn't do it, just the midwife didn't make it to the hospital in time. So where do we deliver? We are at HCA Hospital, which is less than 10 minutes from our office. And we've been there, those of you, if anyone has been with us before, we were at Ascension for several years, and our move to HCA has been fantastic. They've been very accommodating in terms of what they provide for support for birth autonomy. And they actually have several ways for you to see the facility, and I encourage you to go and take a look at it. Quarterly, they do stork tours. The next one is February 19th. So write that down. February 19th at 5:30. Just go to their website and click on register for a class, and you'll see stork tours, and you can sign up for those. When you come in for your visits, you'll see very colorful flyers prior to the 19th, and just use the information there to sign up for that. If you can't make stork tours every 2 weeks, Brittany, our childbirth educator, does do labor and delivery tours. So you can also sign up for those on the website. Our office is open Monday through Thursday from 9 a.m. to 1 p.m. We close for lunch from 1 to 2, and then we reopen at 2, and we're open until 5. So if you call between 1 and 2, we have the phones rolled over to the after hours line. It doesn't mean that the phones are broken or the office is shut down. It is the after hours line because that one rings to our on-call provider. So if you're having a medical emergency between 1 and 2, it rings straight to the person who is in the hospital taking care of medical emergencies. So leave a message for her if that's your situation. If it's something administrative between 1 and 2, don't leave that message on that phone because she is the emergency on-call person. She's not calling to relay administrative things. I'm going to be late for my 2:30 appointment. Don't leave that on the voicemail between 1 and 2. Just call us back at 2 and let us know. On Friday, we're open from 9 to 1. So if you're calling with something administrative at 10 minutes to 1 o'clock on a Friday, it may have to wait for a response until we reopen on Monday at 9 a.m. We do not have walk-in appointments because our goal is to see you at as close to your appointment time as possible. And let's say you have the 12:40 appointment and someone walks in at 12:32 and says, I really need to be seen. Well, that's going to push your 12:40 appointment back. That's not fair to you. So our goal is to try to keep some order because appointments are non-emergent for the most part. If you're calling with something that, I don't have an appointment for 3 weeks, but I really do need to be seen for this sooner, there are times that people deliver, cancel, whatever, and we get some limited same-day appointment slots. You call us in the morning and it's something that can wait until there's an open space, that's where we'll try to put you. If you call us, though, with something urgent, I'm not feeling my baby move, I want to come to the office, but we don't have an appointment until 2 o'clock. We're not going to have you wait for 6 hours not feeling your baby move to come in for an appointment. We might recommend that you're either seen on labor and delivery for something like that, or if you're having chest pain, shortness of breath, we're going to say you go to urgent care. It's not us saying that we don't want to see you. It's us saying that we don't think your urgent matter should sit in our lobby waiting for us to work you in for a scheduled spot. When you call, we're not able to personally leave the visits to take phone calls. Again, we promise you the 2:40 slot to talk to us. If someone else calls at 2:42, I'm not going to say, oh, I see you brought a bunch of questions, but someone else calls as if their questions are more important than yours. So when you call, we're seeing other patients, but we do have people who are in place to take messages and sometimes answer some of your clinical questions. So when you call, please leave a message in order to receive a call back. So if they're on the phone with someone already, they will get your message and they will call you back, but you have to be sure you're leaving the message in the right place. So if it's something pregnancy administrative, like letters, forms, or nurse calls, those are actually going to be divided. Today was Sierra's last day, so we'll be changing this slide, but it'll be divided between Jennifer and Kylie. Many of you have already had contact with Naisha, our OB clinical coordinator, and she's in charge of referrals, labs, like if we're having issues getting your labs back from one of the outside vendors. At the end of pregnancy, if you need your delivery scheduled, version scheduled, baby circumcision scheduled, Naisha is the coordinator for those. Or if you need to see high risk, the hematologist, cardiologist, whomever, Naisha handles all that coordination. If it's something about your insurance, many of you have already spoken with Renee Hall, our benefits coordinator. So if anything changes about your insurance, it used to be that everybody flipped over on January 1st, but sometimes your insurance flips on March or May or whatever. If there's something new that we need to know about your insurance, please reach out to Renee Hall and she can rerun benefits, let you know whether we still need to be collecting on a payment plan or if there's some new obligation that we didn't know about before. If it's after hours, just call the same phone number that you called to make an appointment. But as I said, it will roll over to the emergency after hours call line. There's always someone from this practice on call for this practice. But remember, she's the emergency on call person. So she is in the hospital physically. You only call her if you think you need to join her in the hospital. If you're not sure, you think you need to go to the hospital. And you have to leave a voicemail because that phone is not set up to just ring any time of day unless people leave an intentional message, because people accidentally call us all the time at 2 or 3 o'clock in the morning, and I don't know how that happens. But yes, definitely follow the steps and leave a message so that you can get a call back. And again, if you don't get a call back immediately, but you think you need to go to the hospital, don't sit at home and have your baby in the car because we didn't call you back. Remember, she's in the hospital, possibly pushing with someone else, doing another delivery. If it's one of the physicians, could be doing a surgery. Please just go to the hospital because again, we're there and we'll be there to take care of you. The patient portal is also a way to reach us, but do remember that response times can take up to 2 business days. If it's a non-action item, like I was just wondering whether these vitamins are better than those vitamins. That's what prenatal visits are for. Bring those questions to your visits, and we may forward that to the person who's going to be seeing you at your next visit. The portal is best used for action items. I lost my lab slip. Can you send me another one? Or I have upper respiratory infection. I need to convert my appointment to virtual because I can't come into the office. We ask you not to send urgent matters on the portal. So if your blood pressure is up, if you're not feeling your baby move, if you're having heavy bleeding, please don't send that on the portal because remember, 2 business days. If you send that to me on a Thursday, the next business day is Friday, the next one is Monday. So it could be Monday before I see this message that you've been concerned about your baby's movements. That is a phone call to the emergency on-call person. We also ask that you don't send blitz messages. So please don't copy paste the same messages to multiple providers. It's abusing the portal, one, because you're having all of us who just want to help you work on one problem instead of there's a lot of us, we could be solving a lot of different problems. A patient very upset one time she went to the pharmacy and there were 5 prescriptions waiting for her because you could treat it with 5 different things, but you message 5 different people. So if it's something that can wait 2 business days, go ahead and send the message, wait. If you still get a response and you need to send it to somebody else, then you can also mention, I sent this before, but I didn't hear back from her. So just so we all kind of know and we're not all working on the same thing. Also, the portal, if you repeat messages over and over again, it can think that you are a bot trying to spam the system and delete your portal account altogether. We've had that happen once or twice, and they're really hard to reinstate. The portal, we also don't want you to try to have a visit on the portal. So if you are sending results saying, hey, what are the pros and cons? What's your opinion on this? Can you interpret these labs? That's a visit. We do visits in the office all day, and then we review ultrasounds, and then we review labs, and then we finish our notes. And after we finish with that, we want to spend time with our families, not open up our portal and see 25 more visits, little mini visits. Text those questions to yourself or schedule an appointment, and we're happy to go over those things in depth with you. Ultrasounds are also communicated over the portal unless there are urgent findings. So if there's something urgently abnormal on your ultrasound, then we will stop what we're doing, break in our schedule, and someone will come and talk to you. That's the one time that we'll make an exception in our schedule. Otherwise, we don't have the results right away. It's just like if we send you to an outside facility and they have to prepare a report and send it to us. So we don't get them for 2 business days. The sonographer finishes her report. We upload them to the electronic medical record system, divide them among the providers. So give us a chance to receive them, review them, and respond. If you know that your anxiety is not going to let you wait 2 business days to see what's on that report, then make an appointment with a provider on the same day after your ultrasound. The techs can print out a preliminary report and answer whatever pertinent question, like is my baby's fluid still high? Is the placenta still too low? Those sort of things. We can answer that quick question and then you'll get the full report within a couple of days. Outside labs also have patient portals like Quest and Natera, but they will sometimes send a notification or the results to you first, but that doesn't mean that we have it. Sometimes you'll open it and see all these things marked red and it freaks you out because, oh, everything is abnormal. Just remember, in pregnancy, reference ranges are different. What they're using are for non-pregnant people. So give us a chance to receive the labs, not from you, but from them, because we have loops that we have to close in terms of we send an order and we get the result back. So give us a chance to receive it from the lab, review it, and release it to you with our commentary. Now, if you've been, sitting on these labs for a week and you're still wondering, okay, I wonder why they're not releasing it to them, then let us know, because we can reach out to the lab and sometimes they just didn't send it to us at all and we can have them fax it over to us. And don't, I say a week. If someone literally just sent me something a week, 2 weeks ago and was like, I did these labs in November and I haven't heard anything, I appreciate her being patient, but please don't wait 2 months for us to find out that the lab never sent anything back to us. The most common reason, which was the case here, is that we did have the lab, but it wasn't in her chart because she used different names at a different facility. This is the most common reason that we don't get labs. We don't have a fax machine here. Things go through the electronic interface. So if you are Susie Doe in one place and Susie Johnson over here, when your labs come in, we don't know who Susie Doe is and it doesn't go into your chart. Ideally, whatever name you're using should match what's on your insurance so that they can cover everything that you're having done as well. But using alternative names definitely guarantees delays. Any questions about how to reach us, office hours, any of that stuff? All right, cool. Let's talk about what to expect at each visit. So first thing to expect is that you're going to forget all the questions that you had as soon as you hear your baby's heartbeat. I promise, it always happens. So text yourself questions. Start a text thread with yourself. I love when I get to the end of my part of the visit and I say, hey, do you have any questions for me? Y'all pull out your phone and you say, actually, I have 7 questions. We want you to wear loose, comfortable clothing so that we can access your belly. We will be listening to your baby's heartbeat at every visit, not doing an ultrasound at every visit, but using the Doppler to listen. We want you to get here about 5 minutes prior to your scheduled appointment so you'll have time to check in, handle any insurance business with the front desk, and then leave a urine sample if you need to. We used to have to do urine samples on everybody, but ACOG, American College of Obstetricians, says we no longer need to do that. You'll know if you need to leave a urine sample. We try to tag your chart so front desk knows to tell you to leave it, but it's typically for people if we're following your blood pressure and we're looking for protein in your urine, following your blood sugars and we're looking for glucose in your urine, or if you've had a recent urinary tract infection and we want to make sure that it's clear. Otherwise, we know you're pregnant, you've been drinking your water all day, and you have to go to the bathroom. So come in a little early so that you can use the restroom and be in the room in time for your midwife to see you. If you're 10 minutes late, we'll still have time to check on you and your baby, but it leaves less time for our little text thread of questions. If you're 20 minutes late, you've missed the entire appointment slot. And again, our goal is to see even the person behind you at her regularly scheduled appointment time as well. If there are openings on the same day, front desk is good about saying, hey, do you think you could hang around maybe 20 extra minutes? There's a spot open on this schedule. Or if that new time doesn't work, then we can try to work you in or reschedule you at a time that's best for all of us. Another question I get is about diagnostic ultrasound. So you had your first diagnostic ultrasound, which diagnosed when your due date was. Diagnostic ultrasounds are separate from your prenatal visits. So the way to know if you have an ultrasound scheduled, because again, we don't do them at every visit, look and see on your portal, do you have more than one appointment time and is there a provider's name associated with your visit? So this is my test, my pretend patient Tina test. And Tina logs into her portal and she clicks on the appointment tab and sees she has 2 appointments on the same day. The first one is at 9:20 with ultrasound, which is not a provider's name. And the next is at 10 o'clock with Dr. Yeckel, which is a provider's name. So Tina knows she has an ultrasound scheduled on that day. And if she wants to bring her family to watch the ultrasound, come on in. And if they want to hang around and listen to Dr. Yeckel give a preliminary report on the things that she was specifically looking for, they're welcome to do so as well. And then remember, afterward, the results will be sent to the portal within 2 business days, unless there is something urgently abnormal, in which case we will discuss those results in that real time and make a plan for what needs to be done then. So if you're checking out of your visits, let's say you're 16-ish weeks and your midwife's like, oh, come back in a month, it'll be time for your anatomy ultrasound. Let the front desk know that you need a prenatal visit and a diagnostic ultrasound visit. So 2 different appointment times when that's due. If you're not due for an ultrasound, but you just want to see your baby because your baby's very cute, you can do a boutique ultrasound. And this is a list of a couple places around town that do boutique ultrasounds for informational purposes. I know there's one in St. Augustine too, but they'll do cute little things like put the baby's heartbeat in a stuffed animal, and they can estimate the baby's weight. And they do sneak peek gender reveals like as early as 14-ish weeks or so. So just know that this is another thing, and ultrasounds are fine. There's no radiation in them. You can do as many as you want. Take a look at your baby. All right, let's do a poll question because y'all are not talkers. When should you expect routine ultrasounds? Will we do ultrasounds at every visit? Do we do ultrasounds at 20, 40, and 41 weeks? Or do you only get an ultrasound if you have a complaint? And the polls are closing in 5, 4, 3, 2, 1, done. All right. Okay, these last couple of sessions that I've had, people have been on it. This is correct. Everybody was right today. So 20 weeks is your routine anatomy ultrasound. If we see everything we need to see then, and we don't need, and we don't have to do any follow-up visits, or we don't detect anything abnormal, that's it until you hit your due date, which is 40 weeks. And then after that, we would take a look for post-dates testing after 41 weeks. All right, so next, let me know if you are able to see the Full Circle website, Full Circle Jacks. Raise your hands or give me a heart if you see it. Okay, fantastic. All right, this is fullcirclejacks.com. This is our website. This is up forever and ever, so you don't have to go through YouTube to find this. But we are going to go through who might be at your delivery. So we'll start with the docs. There's me, there's Dr. Marrow, Dr. Yeckel, Dr. Mooney. There are the midwives, Midwife Lauren, Midwife Krista is unfortunately leaving us. Midwife Cindy does less time here now and is probably going to be phasing out as well. Midwife Norma is hospital-based only. Midwife Kayla, Midwife Jordan, Midwife Brianna, Midwife Jackie. And then we have Vanessa here, who is our physician associate. If you know you are having a belly birth, which is our term for the cesarean delivery, then you'll be seeing Vanessa, and then obviously one of the physicians will be at your delivery. Over here under patient information, you will see the obstetrics tab, and you'll know you're in the right place because you will see all the bellies, and then at the end there's a baby, and eventually that graphic will load. But as it is, we're going to look at some of these other boxes that are coming up. Delivery stats. We are very transparent about our numbers here. So some of you are here because of our numbers. If you're a first-time mom looking to avoid an unnecessary cesarean, you come to the right place because we do track what is your chance as a first-time mom who's coming in expecting to labor. What's your chance of actually converting to a cesarean delivery? And did we put our 2025 numbers out here yet? If we didn't, they are coming soon. They were better than our we haven't, but they were better than our 2024 numbers too. So if you had a C-section before, I think we had some veteran moms out here, and you're trying to do a VBAC, we did better last year. And labor to cesarean rate was actually lower last year too. So take a look at those. We need to put that on social media before we put it out there. So you'll see it soon. But we're going to click here on the prenatal care timeline because I want to go through what to expect at your visits. So everyone on here has already had a confirmation visit, and that is typically done between 8 and 10 weeks. And that's when we set your due date. So you see Taylor, our sonographer, meet with one of the midwives, see Renee, possibly get some blood work done. If you choose to get your blood work done on that day, we're typically doing your standard prenatal labs. We also have lab transparency here because when people transfer to me and I'm like, okay, have they already done your this, and this? They're like, I don't know. They just said I needed some stuff done. You can always look out here and see what it is we're offering you, what we drew, whether you're on track for what should be done for your gestational age. If you decide to do genetic testing, we do draw that in the office as well. You have to be at least 10 weeks to get it done. So if you did your confirmation before 10 weeks, we might have you come back for it. If you decided to opt out of it, then we may have just drawn your blood work on the same day as your confirmation. But at this point in pregnancy, we're seeing you every 4 weeks in person. So roughly 4 weeks after your initial visit, you're coming back to see us for your physical exam. And the physical exam is just like it sounds. It's a physical. So heart, lungs, breast exam, pelvic exam, but not necessarily Pap test. Pap and pelvic are two different things. So Pap test is screening for cervical cancer. Pelvic exam is looking to see is there any abnormality with your pelvis. Um, so if you want a Pap test, you'll have your pants off. So you're welcome to have one done, but it's not a required part of the standard prenatal panel. The part of the prenatal panel is cervical cultures. If you're not comfortable doing a pelvic at all, you can do your cervical cultures and collect them as a self swab. Just let your midwife know when you're at that visit. If you have a high risk issue and need to see the high risk doctors, which is something that we'll find out when you do your virtual history visit with me, which is usually shortly after you have your confirmation visit, I send that, and that they usually answer that referral and see you somewhere between 12 and 14 weeks. Then we see you about 4 weeks later and you're in your second trimester, just like that. This is the fun time because you start feeling the baby move. It's not so fun because you may start getting around ligament pain, but we'll talk you through it. And then we see you again around 20 weeks for that anatomy ultrasound. So if you did not do genetic testing back then, this is the first time that you'll have a chance to find out if your baby cooperates, whether it's a boy or a girl. And you'll see here in the middle mental health screening too. So postpartum depression, rage, anxiety get a lot of press, but a lot of these issues, there were antepartum clues before you deliver that you're at risk for this. So we start screening you early for anxiety and for depression. So we ask that you do help us help you, because there are some resources that we can get in place early to try to prevent you from having to suffer through some of those things. If you're meeting with a midwife on or around your anatomy ultrasound day, she's going to start talking to you about childbirth education or breastfeeding classes. I'm going to touch on those a little bit later. Then around 24 weeks, we're going to do glucose testing. I may have some questions about that, so put a pin in it. I'm going to come back to it. For my moms who have a certain blood type, we will make sure that you have RhoGAM to administer around 28 to 30 weeks. We'll talk to you specifically about what that is and why it's important. This is around the time too when we want to have you pre-register at the hospital. It's all done online, so you're going to scan the form at the front of the office when you check out. And you'll be scheduling your hospital tour. If you're going to work with a doula, we'll talk about doulas in a moment. We'll do that as well. Oh, I finally have a question here. What is your reason for an ultrasound at 40 weeks? So going past your due date, ultrasounds and last cycles aren't always very accurate, and we know that the placenta starts to give out after it's been working for a certain amount of time. So if we're starting to see signs of decreased fluid, that means decreased perfusion of the placenta, and decreased blood flow to the placenta means decreased blood flow to baby's kidneys, which means less fluid. So this can be our first sign that maybe the placenta is getting ready to peter out, and it may be time that we need to induce rather than wait for baby to give the signal. All right, then we move into our third trimester. Great question, though. We move into our third trimester, and this is where we start seeing you every 2 weeks. So for my veteran moms, you want to be sure, you'll find out whether you're going to stay with your same pediatrician. My first-time moms, you want to select a pediatrician. They have meet and greets in many offices around town. You'll see here in the middle the option to repeat or decline your standard prenatal labs. ACOG recommendation is to do the screening once during pregnancy. And the Duval County Health Department is for high-risk populations to screen more than once. If you feel you're not in the high-risk population, just sign a form saying that's not me, and we don't have to repeat that. The next question I have here is, if a mother is found to be high risk, then will she no longer continue at full circle? It depends on what the high risk thing is, because there are some things that when you go see the high risk doctor, they say you can't deliver at a level 2 hospital. You have to deliver at Baptist or UF Health, and then you have to transfer out. But if it's what I'll call normal high risk, like the things that we see a lot of, blood pressure, gestational diabetes, that sort of thing, you're still our patient, because the high risk consultants don't deliver babies. They just make recommendations, and we're still your primary care provider who does your regular prenatal care and does your delivery. Next question is, are vitamin D and hemoglobin A1C standard labs that you do? They're not standard, but they are ordered for specific patients with specific backgrounds or histories. All right. Oh, y'all are awake now. All right. So we continue with the every 2 week visits until we get to about 36 weeks. So my moms who know that they are having a belly birth for whatever reason, previous fibroid surgery, multiple C-sections, that sort of thing. When you hit the 33-week mark is when Naisha, our OB clinical coordinator, starts to request your date for delivery so that you can start planning. At 36 weeks, we do another pelvic exam, which is a screen for group beta strep, and we'll explain what that is and why it's important. If you've opted out of repeating other STI screening, you can also opt out of repeating STI screening at the end of pregnancy. But this is when we start seeing you weekly. So at 37 weeks, you are full term. 37 weeks is full term. 40 weeks is your due date, but 37 weeks is full term. So after 36 weeks, bring in your birth plan because you're not preterm anymore. All things are on the table. Let's talk about them. Let's talk about natural cervical ripening methods, which we'll talk about in a moment. All of our belly birth moms are typically out by 39 weeks. So usually somewhere between full term 37 weeks and 39 weeks is when we'll be planning for your belly birth. And then 40 weeks is your due date. So we start post-dates testing, as in the question we asked before, and we are patient. Our goal is to have everybody out by 42 weeks because the risk of stillbirth increases dramatically after 42 weeks because that placenta does give out. So first-time moms, if you haven't gone into labor on your own by 41 weeks and 5 days, we want to start your induction because it could take us 2 days. It can be 48 hours. Second-time moms, usually your labor is about half the length of first-time moms, so you get to 41 weeks and 6 days. So remember, this is out here for you to take a look at your convenience. Next, I have a poll question. If you have a headache, are you more likely to take a Tylenol, meditate, or, oh, hold on. Oh, wait a second. That last poll is still up. Oh, all right, let's go back. All right, if you have a headache, are you more likely to take a Tylenol? There we go. Go to the emergency room or meditate. And the polls are closing in 5, 4, 3, 2, 1. That other poll was up that whole time and nobody said anything. Could y'all see what I was pointing to? All right, polls are closed. I'm sharing the results. All right, today we have, what's interesting is the ratio here is about the same number of first-time moms say meditate and veteran moms say they'll take a Tylenol. Is that because now that you've had kids, you are more prone to headaches? Are kids headaches? Maybe. All right, this is a list of safe medications in pregnancy. So over here on the left, you'll see an alphabetical list of discomforts in pregnancy, relief measures. So this is what we're going to first tell you to try to do. And cold symptoms doesn't have anything here in the middle because we kind of broke them down. There's congestion, there's cough, there's sore throat, there's headaches, there's nausea, vomiting, all of that. So just know that there are relief measures that we recommend first. If those things don't work, then over here there are, there are Eastern and Western recommendations, everything from peppermint oil, super aloe tablets, papaya enzymes, ginger, alfalfa, to Benadryl, some vitamins, Prilosec, Pepcid. So when you send a message, the first and say, oh my gosh, Dr. Adams, I'm constipated. What can I do? The first thing I'm going to ask is, have you tried everything on our website? And I'm going to send you this list. If I don't hear back from you, then I know you didn't try everything yet. Some of you have gotten smart. Once you tried everything on the list, then you send me the message and say, all right, I've tried everything on your list and nothing is working. I'm still backed up. What can I do? And then we talk about other things that you can do. But this is going to be the first place that we send you because these are the most common things that everyone asks us about. The next box here is about gestational diabetes. I'm not going to go into it right now, but I want you to know this is here because I will be referring to it shortly. This gives you instructions on how to prepare for the test and tells you what the patient-driven options are for the test. So remember, we had that conversation. We're going to talk about weight gain in pregnancy too. Because some of you are concerned that you have not gained enough weight in your first trimester. And don't worry, it comes along later. So There's a link here you can click on and put your pre-pregnancy height and weight in. It gives you your pre-pregnancy body mass index. And what's recommended for weight gain is here in the middle based on what your body mass index was. If you have twins, you can add 10 pounds to the upper limit of each of these. But what I really want you to see is the rates of weight gain are in your second and third trimester per week. So in your first trimester, we know nothing tastes good. Everything makes you nauseous. You're tired. You're sick. And so you're not gaining any weight. You might even lose a couple of pounds then. When you start your second trimester, that's the weight gain that we start looking at in terms of how much you gain total for your pregnancy. Next, we have our birth preferences. So for those who are interested in making a birth plan, we call them birth preferences because we're veteran moms and we know babies have plans too. So this is what you would prefer for your baby to allow you to do because babies are the boss. It goes with everything from what you want to wear in the hospital, how you want your labor to start, how you want to be monitored. Just some things I want to highlight. There's hydration and food here because we're not starving you. There's positions for labor, pushing, and delivery because we're not putting you on your back or making you stay in the bed. In general, like obviously there are case by case situations that may change this, but for the most part, these are all things that are matters of preference or opinion. There's nothing dangerous inherently that is on this list. So, and not all of the boxes will apply to everybody on the call. So not everyone on here has twins. Not everyone on here has a boy, or will be planning a belly birth. So what I tell people is take one box per week and then just and go through it and find out what things are salient to you. If you have questions about them, you're going to be seeing a midwife like 10 or 12 times during this pregnancy. So feel free to come in and ask your midwife, all right, what is this even? What is vocalization? What is that? Does that apply to me? Do I want to do that? And that's what she's here for, to help you go through this. Or your doula. If you're working with a doula, they'll help you with this as well. Next, we see cervical ripening techniques because at the end of pregnancy, you all get on the internet and start doing some really crazy things trying to get these babies out. Everything on here is from evidence-based birth, okay? So please take a look at these things. Some you can start as early as 20 weeks, raspberry leaf tea, because it tones the uterine muscle. None of these things are going to put you into labor because your baby puts you into labor. Your baby gives the signal about when he or she is ready for labor to start. So there are things that will tone the uterus, soften the cervix so that when your baby gives that signal, your body is ready to receive it and perform more efficiently. So remember that this is out here without castor oil, just so you know. Question. We didn't have very many veteran moms on here, but I am going to ask, was there anyone on here who's had a C-section before and is going for a vaginal delivery? And that poll is going to close in 5, 4, 3, 2, 1. Okay. All right. Okay. So it looks like the veteran moms that we do have out here actually have had a C-section and they're going to rock it. Fantastic. Remember I told you, you're going to have, like, I think last year we had 80%, which is at the top of the nation, of the nation's averages for VBAC success rates. First-time moms, though, listen up. This box is for first-time moms and trial of labor after cesarean moms. You're in the same boat. You're trying to avoid a C-section in a situation where your pelvis may or may not have been proven before, like no baby has been through it. So many of you already know I'm a VBAC mom. Dr. Merrill's a VBAC mom. Midwife Lauren is a VBAC mom. So we are not just VBAC tolerant. We're VBAC supportive. Like, we want you to win. First-time moms, we want you to not have to go the way that we had to go, have the C-section first, and then be a VBAC mom. So please take a look at these recommendations because quite a few of them, before Dr. Mooney joined us, Dr. Mary and I kind of went through and we're like, man, there are some things I really wish I had done differently in order to try to avoid that first C-section. So please, please, please read this list. What you'll hear me say more throughout this call is that position is more important than size. Are you growing a big baby? Fine, whatever. It'll come out or it won't. But if your baby's spine is toward your spine instead of spine towards your back, first time mama, you have a 5% chance of a vaginal delivery. We want this, not this. And so we want you to do spinning babies, get a doula, watch your weight, do your squats, all the things, because we want to get your baby in an optimal position so that your pelvis is not the hindrance to your baby escaping. All right. And then lastly, if you have a little guy and you want to have him circumcised, those are not done in the hospital. Those are done here in the office within 10 days of birth. So typically we'll ask you during pregnancy to see if that's what you want, confirm it after he's born. And if so, then Naisha will set his appointment, send you a portal message, and he will come in for his first little appointment where we will spoil and snuggle him. All right, so remember, all of this stuff is at Full Circle Jacks under the patient information tab where it says obstetrics. All right, and now we are headed back to our presentation. So raise your hand or give me a heart if you're able to see this delicious drink with all the sugar and calories. Okay, yummy. All right, so those of you who are saying, oh my gosh, but I am gaining weight in my first trimester, Dr. A, and all I'm doing is drinking a coffee in the morning. I'm just minding my own business. Are you drinking a coffee or are you having one of these salted caramel mocha monstrosities here? They are so delicious. Did you know that pregnancy only, I love somebody raise their hand. I love you. Pregnancy only requires an additional 300 calories per day. Now, you know what? I don't know if you were raising your hand to ask a question. I thought you were raising your hand to admit to drinking the mocha monstrosity. So if you have a question, just put it in the chat. But if not, then I think you're hilarious. It only takes 10 calories to maintain 1 pound of body weight, and your pregnancy goal weight is based on your starting body mass index, as we saw from the website. So if you're starting the pregnancy at 170 pounds, it takes a net caloric intake of 1,700 calories to maintain that. If your goal is to gain 25 pounds, that's 250 additional calories that you get for a total of 1950. You divide that between breakfast, lunch, and dinner. That gives you 650 calories per meal. Now, babies don't know the difference, bodies don't know the difference between food and drink. So you cannot eat a 650 calorie meal and wash it down with a 570 calorie mocha monstrosity. So it's mindful of all the calories. Like that shake was really almost a whole meal there, honestly. This little busy slide here talks about where to get those calories because you don't want to get all the calories from fat. You want to get some from carbohydrates, some from proteins. This second part of it is just emphasizing what small changes can make. So sodium at the end when your rings don't fit anymore and you don't know why, try switching from traditional spaghetti sauce to 20-minute herb infused marinara and you'll cut out 500 milligrams of sodium. If you start flipping things over and realizing what is in everything, it will absolutely horrify you. So things you want to eat, fruits, veggies, whole grains, cereal. You will not give your baby a nut or dairy allergy by eating those things in pregnancy, so carry on. For my coffee drinkers, you want to keep your caffeine at less than 200 milligrams daily, which is still a lot of caffeine. And also remember that caffeine is a diuretic, so use the 3-to-1 rule. However much caffeinated beverage you're drinking, take in 3 times as much water so that you're still staying hydrated despite taking in the caffeine. And remember, if there's a reason we put a limit on something, it's usually because it can cause something. Later on in pregnancy, excess amounts of caffeine and excess can be different to everyone. Like 100 could be excess to one person or 50 could be excess to someone else. Can cause irregular heartbeats in the baby. So if you can do less, but definitely keep it under 200 altogether. Herbal teas are great. These are some of our favorites. We talked about raspberry leaf already, but also ginger and lemon and peppermint are good for first trimester stomach ickiness. For my vegetarians or pescatarians, you want to keep your protein around 70 grams daily. I know there are some pregnancy diets that tell you cram the protein, eat 120 grams of protein a day. First of all, oh my gosh, that's so much. If you do, you will very likely grow a 10 or 11 pound baby. And that, I mean, even with the back forward, that just makes life difficult for all of us. So watch your protein intake. 70 grams is the sweet spot to grow a normal, not scrawny, but not humongous baby. And keep mommy with good muscle tone as well. You can eat deli meat. Yes, you can. Just be sure you're microwaving it 30 seconds to get any harmful bacteria out. And it doesn't have to be piping hot for you. Like, don't burn your mouth. But 30 seconds is enough for any deli meat for you to eat. Soft cheeses, if they're made with pasteurized milk, that's fine as well. If you're out at a restaurant, you can't verify if it's pasteurized milk or not. I mean, most restaurants aren't taking that risk. Then maybe you don't eat the brie for the evening. But if it's made with pasteurized milk, you're at Trader Joe's, you can flip it over and see it. That's fine. Canned tuna, you can have 3 4-ounce cans per week. If you are pescatarian and you need more fish, The FDA has a really nice document. It says October 2021, but this is the latest iteration of this document. And it has lots of good information on fish you should eat a lot of because it has high DHA, which is great for baby's brain development. Fish you should eat in moderation because they're kind of neutral in terms of their benefit to you. And fish you should avoid because of higher methylmercury content. So just remember that that is out there as well. Undercooked meats and fish you want to avoid. So that yummy ahi tuna, the almost seared tuna, so yummy. That's not for you. Not until the sushi. No, no, not it. You can have the fried, cooked all the way through sushi. Sorry, you have to ruin your steaks for the next 6 months, and they must be well done as well. Have a question here. My kombucha, excuse me, my kombucha drinkers, my kimchi eaters, those can be fermented and it is because sometimes fermented things, depending on how the process is, sauerkraut too, your body can treat it as an alcohol, so limit it. If it is actual alcohol, we say cut it out because we don't know how much alcohol is okay in pregnancy. Fetal alcohol syndrome doesn't have at this threshold you will definitely get, or at this threshold you definitely will not get. So to be safe, we say avoid it altogether. And then you want to keep your sodium under 1,500 milligrams per day. So remember your herb infused marinara, where you can cut out 500 milligrams in one fell swoop. That makes a big deal now that you're trying to keep the whole thing at 1,500. Question I have here is, I heard that on my first trimester, I should avoid all canned food. Is that accurate? No, it is not. Especially if you're like cooking the food when it comes out of the can, like you're going to get rid of any harmful anything that's canned. But no, there's nothing specific about canned foods that you have to avoid. All right, now that we've talked about food, we are moving on to exercise. So it is fine for you to continue your pre-pregnancy activity unless your pre-pregnancy activity was doing nothing. You just won't feel like it in your first trimester, and that's okay. Everybody's sleepy and all the things. You'll feel better. In second trimester, you get physiologic changes that accommodate more activity. You're going to increase your blood volume by 50%, more red cells, more oxygen tension and saturation. So just listen to your body. You'll be able to return to doing longer stretches of activity without feeling miserable. If you weren't doing anything before, no judgment, but it is okay to start a new regimen. Yes, it is. First time moms, VBAC mamas, please, if you weren't doing anything, start a new regimen because a sedentary lifestyle leads to malpositioned babies. And I cannot stress enough that the most common reason that we do C-sections is not because babies are too big or in distress, but because they are in bad position, little crooked heads, little sunny side up heads, and they won't come out. They won't fit through the pelvis, not because they won't fit, but because in that position they won't fit. I do have a question out here now that states, whoops. Okay, I have a question here. How about pepperoni on pizza? Yes, you can have pepperoni on pizza. It's typically cooked. Like they usually will add the pepperoni and then cook it all together. So that's fine. Um, those of you with these cute little Fitbit watches who are creating more anxiety for yourselves by watching your heart rate. If you notice that your resting heart rate is higher by 10 to 20 beats per minute, that is normal. That's a physiologic change of pregnancy. It means your body is doing what it's supposed to do. That's okay. As long as you're not getting dizzy or lightheaded, then it's okay for your heart rate to be a little higher. If walking is your exercise, be sure that your heart rate is in the aerobic zone for it to actually count as exercise. The aerobic zone is 70% of your maximum heart rate, which is based on your age. So 220 is our top. And you subtract your age from 220. So if you're 30 years old, you should not be exercising with your heart rate above 190 for prolonged periods of time. This is also true outside of pregnancy too. I'm giving you a lot of good life information. 70% of 190 is 133, and so that's where your aerobic zone begins. So if when you are walking, your heart rate is between 133 and 190 sustained for 30 minutes, 3 times a week, then that is aerobic exercise. That's your exercise goal. If when you're like, oh, I'm walking for exercise, but your heart rate is like 80 to 100, I mean, it's transportation, but I don't know if it's actually exercise. Safe pregnancy exercises. You can do cardio. Yes, you can. Treadmill, elliptical, running, swimming. Swimming is my fave. So if you can find a heated pool to make that belly weightless, so good for your joints. Indoor bikes, Peloton, all the things, those are fine. You can lift pre-pregnancy, however much you were lifting before, continue at that amount. You do not need to increase your resistance during pregnancy because your baby and your body will be doing that. Squats, you want to build up to a minimum of 50 per day. If you're already squatting and you're doing more than 50 a day, wonderful, go for it. If you're not an experienced squatter, once again, first time moms, VBAC moms, squats. At 20 weeks, you're giving me 5 a day. 21 weeks, you're giving me 10 a day. 22 weeks, 15 a day, building up to a minimum of 50 per day. They don't all have to be at the same time. And if you have an appointment with me, you never know. There might be a quiz. Sometimes patients are like, you're going to do what? I grab your hands and we squat together. We squat together. Okay. And I'll know whether or not you're doing them. And sometimes I just show up in labor and we squat together. Pilates and yoga are two of my favorites. And any experienced instructor will be able to tell you what the pregnancy modifications are. The question that I have here is squat with body weight. Yes, if you're not already squatting with weights, squat with your body weight. But if you are already squatting with weights, squat with whatever weights you were already squatting with. Just continue what you were doing. Things you want to stay away from. High intensity interval training after first trimester. It's not the interval, it's the intensity. You can still do the low impact version of these exercises. Lying flat on your back, anything that has you on your back for extended periods of time, like excessive ab work. You can do side lying abs, you can do standing abs, but just not on your back, crunching abs. Hot yoga, unless you are a hot yoga instructor, you'll get dizzy and probably fall in there, and we don't want you to fall on your belly. Scuba, obviously for changes in barometric pressure and decreasing oxygen to the baby. High altitude hiking for the same reason, decreased oxygen content at those higher altitudes. So you can visit in pregnancy 8,000 to 10,000 feet above sea level. You have family in Colorado, it's fine, go see them. But don't go hiking with them because that has an increased oxygen requirement that it just isn't there for you. Contact sports, please do not take up kickboxing during pregnancy. Outdoor biking after 16 weeks is not a no, it's just to be careful because your center of gravity changes at 16 weeks. And as you go to turn corners, you may find yourself falling all the way over because you did not anticipate that the weight would shift that much. All right, so now that we have gone through nutrition and we've gone through exercise, let me ask you a question. Can you prevent gestational diabetes with diet and exercise? I have a lot of first-time moms here, so I'll be very curious to know what the answer is. And the polls are closing in 5, 4, 3, 2, 1. Done. Oh my gosh, all of you got it wrong. The key word here is prevent. You cannot prevent gestational diabetes with diet and exercise. You can manage it with diet and exercise, but getting gestational diabetes, being diagnosed with gestational diabetes, is not a judgment on your lifestyle at all. It is your hormones. You know how, like, when you're not pregnant or when you are pregnant, we blame everything on our hormones? Same. You know what's another hormone? Insulin. Insulin is a hormone. And your placenta gives off other hormones that tell insulin not to do its job. Now, insulin's job is to clear your body of glucose. Take that glucose, put it into cells to use for energy. The placenta says, hey, insulin, you should call out sick today. And when insulin calls out sick, you're left with glucose just circulating in your body, not being used for energy. And when we draw your blood, we're going to see that extra glucose. Extra glucose in your blood is diabetes. But it's diabetes because your placenta said for your insulin not to do its job. So if you do not have a placenta, I do not have to screen you for gestational diabetes. But if you have a placenta, then yeah, I should screen you for gestational diabetes. That's your risk factor. That's it. I'm not talking about family history. I'm not talking about your body mass index, how much sugar you eat, or whatever. If you have a placenta, you're at risk for gestational diabetes. So for my moms who say, but I never eat sugar, Dr. Adams, don't avoid your carbs. I know you eat fruits and you eat whole grains. If you try to avoid those prior to the test, like, your body knows how to process carbohydrates. So you'll give yourself a false positive if you avoid those prior to. If the drink itself is what bothers you, I got you. We have several patient-driven options. Remember that the part that I showed you on the website, we have glucorganics, we have fresh tests, we have glucose tablets. Here in the office for sale, we use Simply Pure. It is soy-free, it is dye-free, it is gluten-free, it is BVO-free, it is kosher, it is vegan, it is offensive to almost no one. So it's just glucose. It's just glucose. And again, like I said, if you decide you want to do Simply Pure or one of those other things, just let us know ahead of time so that we can be prepared for you and give you all your instructions on how to take it. All right, preparing for birth, because one day you will give birth. Childbirth education classes. These are method classes. And they're not just for people who are looking to do unmedicated deliveries. Like I did hypnobirthing, which is one of the ones that's on here. I did hypnobirthing, but I planned an epidural. I just didn't want to get my epidural when I was 2 centimeters because I couldn't take it. So, I did my breathing and all the things and worked with my doula. But on here represented, I think, is hypnobirthing, hypnobabies, Bradley method. I don't think I have a Lamaze one on here, but just know that these are for information. It's a good starting point. If you start Googling these things, believe me, Facebook will start bringing you, or Instagram will start bringing you all of these things because social media is always listening. Breastfeeding classes. HCA has a lactation consultant, Sonia, who is amazing. So she does breastfeeding classes. These are things you want to think of late second, early third trimester, because sometimes it's a series and you want to make sure that you have time to finish it before you deliver. Every new parent should know CPR. Here's a link to the Red Cross. Even if you know adult CPR, infant CPR is different, and it's not bad to have a good refresher. Chiropractic care, if you're already seeing a chiropractor, great for you. Again, great for hip alignment, which helps those babies to get into good position. Be sure that he, she, or they are Webster certified because that is a special certification that accounts for the different changes that your body goes through so that their adjustments are safe for pregnancy. How many of you are planning to work with a doula? A lot of first-time moms here, so I don't know. Okay, fantastic. But I see there are some people who are, some who aren't, and some who are not sure. Okay, fantastic. Polls are closing. Cool. All right. So for those who are, you make my heart very happy. I love doulas. For those who are unsure, I am here to talk to you about what doulas are for. What's a doula? You're like, I have a midwife, I have a doctor, I'm going to have a nurse, possibly an anesthesiologist. Who are all these people? Doulas are there for emotional and physical support before, during, and after pregnancy. So, again, it's not just, and they're not just for people who are planning unmedicated deliveries because, again, first-time moms, you've never done this before. And I do not envy you for all the information that's out there right now. There are so many people saying so many things about how you're a bad mom if you don't do this. Doulas are there for the anxiety that comes with going into a place that you've never been and doing something that you've never done. So breathing techniques, position changes, relaxation strategies during labor. We're not the practice that doulas feel like they have to defend you from unnecessary interventions from at all. So they are there to support you. You have midwives, but your midwife might have 3 patients in labor at the same time. Your doula has you. You are the priority from the time those contractions become regular until that baby is out and latched and breastfeeding. They're not clinicians, so they're not giving medical advice, providing medical care, prescribing medicines, or delivering your baby. They are helping you process your feelings about the medical advice and care that you receive from your team. Also kind of helping you, open lines of communication and talking to us about things that you don't understand about our recommendations. So doulas are wonderful advocates for good open lines of conversation. Ask the midwives who they love as doulas and who they like working with and who they've seen support our moms beautifully. Acupuncture and pregnancy massage are definitely advised. Acupuncture can help with morning, everything from morning sickness in first trimester to back pain and things in second trimester to baby come out treatments at the end of third trimester. Acupuncture is amazing the whole way through. When you come out of the bathrooms in the front of the office, you'll see business cards for people who do massage and acupuncture and all that stuff. And those are people who we know work on pregnancies. Most of your insurances will cover breast pumps. We have codes in our in the rooms, QR codes for you to scan. Around your ultrasound time is a good time, just kind of an arbitrary time to do it. Put your insurance info in. They will send you they'll send you a list of what your insurance covers. You click what you like, they write the prescription, send it to us. All we have to do is sign it. Please don't go look for your own company to provide the breast pump. I know some places, like there are some insurances that can't use our QR code, but very few. When you do your own, inevitably you end up writing to me, Dr. Adams, I can't find my prescription. No, they've sent it 5 times and no one can find it. It's because this company just gets it right. We get zero kickbacks from them other than getting our time back, not having to chase down things that never happened. All right. For those who are going to be using the Family Medical Leave Act to take off time to be with your baby, we use a third-party company, Leave Guru. We've been using them for a couple of years, and it's been amazing. Anyone who's ever had to have FMLA paperwork filled out before knows it can take up to 2 weeks, depending on, the right form and the right diagnosis and all of that stuff. Most of these forms, they're finishing in less than 24 hours, if not 10 minutes, and you can complete it unlimited times at no additional cost to you. So Kylie's the one who's going to get you connected with that. Question I have is, I know most places won't give any massages until second trimester. When is it okay to start maternity massage? Good question. So it is actually safe in first trimester, but because there's a higher risk of miscarriage in first trimester, a lot of places won't do it because if something completely unrelated happens, they don't want you to associate it with, oh, I got a massage and then something bad happened. Some of them will still require a letter from us. So if you're planning to get a pregnancy massage in second trimester on, we do have a pre-printed letter that we can email to you so you can furnish to them. Postpartum care. So moms who have issues with their blood pressures during pregnancy, and first-time mamas, please hear me well, first-time mamas, 1 in 8 of you will have an issue with your blood pressure, and you've never had an issue with your blood pressure before. And it is because of placental hormones. Again, it's not anything that you're doing wrong. It's not because you were rushing when you came in. It's not because they made you mad at work. It's not because of anything else, but just because of the hormones at the end of pregnancy create constriction of your blood vessels. And that is sometimes gestational hypertension. It's sometimes preeclampsia. But if it's you, if we have to deliver you because of blood pressures, just know that we're going to be seeing you back in the office sooner, because the most dangerous time for preeclampsia and gestational hypertension is actually in the first 14 days after you deliver. So we'll want to see you back for a blood pressure check. If you have a belly birth, we're going to see you back in 2 weeks to take a look at that incision. If you had any issues with antepartum, anxiety, depression, all of those things, then we'll be doing routine mental health screens. About 80% of you will have baby blues, which are normal. You cry at every little picture and it's really, cute and weepy and soggy and sweet. But usually you dry up, Buttercup, right around 2 weeks. If you're persistently being sad and not being able to can after 2 weeks, then we might have to start thinking about a diagnosis of postpartum depression or anxiety. And we really want to get ahead of that as soon as possible. Postpartum doulas are magical angel people who come to your house and let you sleep and take overnight feedings for a fee, of course. But please look into them, especially if you already know you have a history of mental health things that have required attention in the past, because that can sometimes be a trigger for some of these too. The Motherhood Space is an amazing resource here in Jacksonville. We're one of 5 cities, I think, in the country that received a grant that covers psychological groups, light therapy, yoga therapy, exercise therapy, and all directed towards moms. It's at the Winston YMCA downtown. And they have childcare for babies 6 weeks to 12 years of age. So if insurance doesn't cover it completely, then the grant makes up for anything left. So no cost to you, very few barriers to using this amazing service. And then pelvic floor therapy, which is standard of care in many countries. We're still working on it here in the US. But pelvic floor therapy, because pushing the baby out is not actually your biggest risk. It is just carrying this baby on your pelvic floor for several weeks. Pushing doesn't help, but sometimes you have lacerations, you have pain afterward, pain with intercourse, leaking urine, all of these things. All of these can be helped with pelvic floor therapy. I didn't find it until after my 3rd baby, and I wish I had it after my 1st and 2nd. Random frequently asked questions. You can sleep on your left side, your right side, and your back. You can sleep on your back. If it makes you dizzy to sleep on your back, just get one of those wedge pillows pillows from Amazon, put it under your hip. That way you're not all the way on your back. You can help paint the nursery. Just be sure that it is well ventilated or you're wearing a mask. You can take probiotics, prebiotics, postbiotics, all the biotics that they have come up with to get y'all's money. Those are all fine in pregnancy. You can dye your hair, including your eyebrows. You can do gel nails. If you're in a salon with a lot of fumes, you may want to wear a mask so the fumes don't overtake and make you feel sick or dizzy. You can travel in a car. Up to 37 weeks is really just because 37 weeks is when you're full term. And after that, your baby doesn't have a calendar. Really, your baby doesn't have a calendar the whole time. Surprise. But at 37 weeks, it's like, I'm full term. I might get out of here. And if you're going on your baby moon to Jamaica or wherever, or if you're driving someplace, down to West Palm Beach, you might have a West Palm Beach baby and not a full circle baby. And that's not what you wanted. Just be sure that you're getting out and stretching every couple of hours, and which you will be doing if you're drinking the right amount of water. Skincare, you can use your benzoyl peroxide, your salicylic acid, as those are topical and don't absorb in significant quantities. Just nothing that has retinol in it. If you need a retinol substitute, bakuchiol, Bakuchiol, is a vitamin A derivative that does not have the harmful effects of retinol and is safe in pregnancy. Air travel. My twins, you can fly up to 32 weeks, barring any other pregnancy complications. Singletons, you can fly up to 36 weeks, again, barring any other pregnancy complications. Please be sure you are wearing your compression hose, medium compression hose, drinking lots of water on the flight, and doing your toe raises in the seats to prevent yourself from developing blood clots in your legs that can go to your lungs. No roller coasters, no water slides. That's it. Y'all will be pregnant in the summer. Lastly, upper respiratory updates, which are current as of today, but that's the last time I needed to update them because nothing else has really come out since then. All the vaccinations are fine. ACOG says that they're okay based on the New England Journal of Medicine study of 35,000 women in April of 21. If you're specifically looking at COVID boosters, Moderna and Pfizer are fine. We don't recommend Johnson & Johnson because of its independent risk of blood clots. All the vaccines are approved for boosters. If you're more than 6 months past your Moderna or Pfizer, that's fine. If you're more than 2 months past your Johnson & Johnson, you can get a Moderna or Pfizer because, again, blood clots, mixing and matching is fine. If you're getting your shots for flu, RSV, or Tdap, you don't have to space them out any particular way. You can do it to just keep your arm from being sore. But we don't do them here. If you want those, midwives will typically start talking about them at the end of second, early third trimester, because that will give you time to have the antibodies to pass to your baby passively when you're breastfeeding. That's the optimal time for vaccines. If you do get COVID, there are no recommendations for ivermectin, azithromycin, or Plaquenil. We do recommend that you don't come here. Convert to virtual appointments. Vitamin D3, zinc, vitamin C, don't come here. Take your low-dose aspirin because we have seen increased rates of gestational hypertension when moms have COVID during pregnancy. Did I mention not to come here? Okay. Then serial growth ultrasounds to be sure that if there is growth restriction due to COVID causing gestational hypertension, we're catching that ahead of time. Y'all, we get hit hard. People come in because they're excited. They want their ultrasounds. And I get it. You want to see your baby, but then you breathe all over the front desk staff. And then they breathe all over the MAs and everybody. And then we are down a lot of people. And people are calling and saying, no one's returning my calls or doing that. Well, no one's here because we're all sick because someone came in and got us sick. So if you are sick, please, 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 we are a well office. And not just a well office, but a well office full of immunocompromised people. So please don't come here and spread whatever you have to all the immunocompromised pregnant people in our lobby. Please and thank you. So supportive therapy at home, unless you have a fever that's greater than 101 that you can't break with normal amounts of Tylenol, or you're having trouble breathing, like actual shortness of breath, please come meet us at the hospital. Not very many veteran moms this time, but so no one here gave birth during the height of COVID. So you guys have no anxiety about that. But we're back to our normal amount of visitors in the room, 4 visitors in the room, plus your doula. Your doula is not considered a visitor. She's part of the birth team. We're not masking in the room routinely. If you have COVID, RSV, or flu during labor, then we'll give you a mask if you're positive during it. And even if that's the case, moms and babies are not separated. You get an isolate to protect baby from your respiratory droplets, and you get an N95 because we still encourage breastfeeding. And our last poll question of the day, you all are going to ace because it is what information is found on the Full Circle website. Can you find birth plans, safe medications in pregnancy, what to expect at each visit, or are you a stellar test taker and you know that all of the above is the answer? All right, the poll is closed. Fantastic. You guys are amazing. Please follow us on all the things. We are quiet as church mice on all of these things right now. And so we're going to get back to posting soon. But do know that we are technically social because we're on all of these things. All right. Thank you guys so much for participating. I appreciate you so much for your time today. Again, remember that this will be available on our YouTube channel. You can watch the whole thing in blocks or whatever for the duration of your pregnancy. Thank you so much for choosing Full Circle. If anything in your pregnancy journey does not live up to what I told you today, please come to me. Like Google is not going to solve your problem. Yelp is not going to solve your problem. You have a direct line via portal message to send me something and we can figure out what's going on, because our goal is really for you to not just have a safe and healthy pregnancy, but an enjoyable pregnancy. We want you to look back and say, man, I was a rock star being taken care of by rock stars. So thank you guys so much. I appreciate you choosing us, and we'll look forward to seeing you real soon in the office. Y'all take care.